is the difference between palliative care and hospice care?
That's a great question, and something that really many people confuse, and not just lay people, but even people in the medical field, even physicians sometimes confuse it and sometimes believe that it's synonymous, and it really is not. Palliative care is care at any stage of disease, usually a chronic disease that's identified, where the patient really would benefit, like Berta was mentioning, from this holistic approach, from symptom management to psychosocial services to spiritual support.
At any stage.
At any stage, all the way up to end-of-life care. And that's when hospice comes in. And in fact, in order to be eligible for hospice, you have to have 2 physicians that determine that you have less than 6 months to live. And we'll talk a little bit about that. This doesn't necessarily mean that you cannot extend that, and in fact, frequently it is, but there is an end-of-life component to that. So palliative care is really from the time that serious illness is diagnosed all the way through to end-of-life care, and that could be many, many years, and there could be a lot of curative treatments along the way, in addition to palliative care.
So what kind of terminal illnesses are common for patients who go into hospice care?
So the most common is probably what most of us actually die of, congestive heart failure, heart disease, pulmonary disease, cancer. There's also a lot of dementia now, since we're living longer, that many families and patients have to deal with. Would you say anything differently?
Yes, I think the latest findings is about 25% maybe cancer patients, and the rest, 75%, are those chronic illnesses that we're talking about. We're living longer with them, but there's a burden of the disease that takes a lot of help and support, and families, especially the caregiver. And so hospice comes in to assist with that, not just with the pain and the symptoms of that, but with support. It's very similar to the palliative team. They have social workers, chaplains, because it's the total pain that we're addressing.